Yes, welcome all of you. Thank you so much for being so many of you. It fills me with great optimism to see that so many of you have prioritised being here today. Because public mental health and mental health promotion matters. Not only does it matter, it's absolutely critical. If we want to enable a sustainable and prosperous society, we need to ensure a population with the highest levels of mental health and well-being as at all possible. Because mental health and well-being affects our short and long-term health, it affects our health and risk behaviour, our abilities to learn and hence to undertake education, it affects our abilities to work and to contribute positively to our communities and to society as a whole. So public mental health and mental health promotion isn't just nice to have, it's need to have. And where we stand today, far too many are languishing and way too few are thriving, and we can and we should do better. It is by far time that we push public mental health and mental health promotion way high up on the agenda, politically as well as scientifically. And it is my humble hope that after today, perhaps even just a few of you may be slightly more motivated in helping us in our endeavours to do so. So welcome. I've got the feeling that there's some sort of resonating in the microphone. Right, that's better. Okay, so if we look at how mental health has developed over time, I think it's fine, we'll just turn this on. It's, oh, didn't help.
Let's see that again.
Pardon? Shall I just try and continue? Yes. Okay, well I'll continue and I hope you can hear what I'm saying. But if we look at how mental health has developed over time, then we've seen a marked decrease in public mental health in Denmark as in the rest of the world. We've seen an increase in mental health problems and languishing. And if we start off by looking at our children and adolescents, surveys from over the past 10-15 years and various studies show that we've seen a decrease in life satisfaction, an increase in loneliness, a decrease in self-esteem right down to the age of 11-year-old boys. We've seen a decrease in school satisfaction, and in just 5 years we've seen over a doubling in calls to Children's Helpline for suicide thoughts and suicide attempts. Now what these children call about are feelings of feeling not good enough, feeling outside, feeling lonely, and also being worried that they cannot live up to the expectations of their parents, or at least what they think that their parents expect of them. In general, all the data we look at suggests an increase in poor mental health, stress, anxiety, and depression. And these are very much survey data and various studies, but if we look at our register data, they show a similar gloomy pattern. So if we look at the amount of incident cases, new cases of diagnosed anxiety and depression in the 0 to 18-year-olds, we can see that there's been over a doubling from 2006 to 2016. We see the same pattern when we look at the adult population. These are data from the Danish National Health Profile, where we can also see a marked increase in the proportion experiencing poor mental health, and especially we've seen this increase amongst the younger adult age groups. We cannot afford any longer to keep ignoring this development. It is high time that we take this seriously. In Denmark, we have really been sleeping in class where mental health problems are concerned. And if it isn't enough of a goal that as a society, naturally we should do everything within our power to try and promote public mental health and well-being to the highest levels possible, then we need to take public mental health and mental health promotion seriously from a financial point of view. Because poor mental health costs the Danish society 14.6 million euros every single year. And this is in expenses to the healthcare system and to social benefits. So So it is very, very expensive just ignoring this development. And also we know that between 1 in 2 to 1 in 4 will experience mental health problems during the life course. So if you take a look around, that's half of all of us. And I hope this makes it abundantly clear, ladies and gentlemen, that there is absolutely no way on earth that we're going to be able to treat our way out of these problems at an individual level. This is why experts, years on end, international expert panels, the WHO, World Health Organization and the EU Commission have argued that if we want to try and change this, we need to start investing in and promoting mental health. We need public mental health promotion. So I quite like this term, public mental health promotion. It's got some sort of proactive vibe over it. But what is this mental health that we need to promote? Already in 1958, Marie Koushede wrote in her book, Current Concepts of Positive Mental Health, that there is hardly a term in current psychological thought as vague, elusive and ambiguous as the term mental health. And I wish that I could say, well, we're 2019, we've nailed it, there's complete consensus. But the fact of the matter remains that mental health is a really, really broad term, just as is physical health. And if you imagine we asked a psychiatrist, what is mental health? Then he or she might answer from one perspective. If we asked a school teacher, a football coach, he or she might answer from a different perspective. And if I asked each one of you, you're likely to all have slightly different ideas of what constitutes mental health. And this isn't to say that some are right and some are wrong per se, but if we're going to work together in promoting something, then it should be obvious that at least we need to work from a mutual understanding and a mutual idea on what premises we're working to promote this something or this mental health. So, in the team I work and in the partnership with the ABCs of Mental Health, which I'll tell you a little bit more about in a minute, we work in line with the World Health Organization's definition, which is very close to the National Board of Health's definition, namely where mental health is a state of well-being, in which each individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and contribute to his or her community. So mental health is a feeling, a state of well-being, mainly being happy about yourself in your life. You can't be happy all the time. And a functioning well in your day-to-day life in relation with others. When I look at this term, to me it becomes clear that mental health is a positive. It's an asset. At least it is way more and beyond merely absence of mental health problems. Yet the focus for mental health, scientifically as well as politically over the years, has mainly been on individual treatment for mental illness or targeted prevention, trying to prevent risk factors for mental illness. And as we can see, this isn't enough. So, mental health isn't something we've just got and then we've got it. Just like physical health, mental health is a continuous process throughout life. It requires looking after and safeguarding. And if you imagine life as a river, where we're all of us down in this river, it goes up and it goes down in life for all of us. But down one end of the river, the water is completely shallow. It is crystal clear. We've got, no currency, undercurrent, and we've got ample of energy to spare. So this is typically where we say people are they mentally healthy, have high levels of well-being, they're flourishing, in other words. And this is where people are more likely to be altruistic, innovative, creative, productive, all the ifs that we would like. So naturally, as a society, our interest is in securing and pushing as many people towards the shallow end as at all possible. Most of us, we're further downriver, where you can say the water is slightly murkier, it's deeper, there's a stronger undercurrent. We've still got our head above water, but we haven't got the energy or the resources to spare that they have up the shallow end. And this also means that we're more vulnerable when a strong undercurrent suddenly comes our way. If we move even further downriver, then the water now seriously becomes murky, strong undercurrent, it's deep, and we start struggling and paddling to keep our head above water and have an overview over our situation. Now, all of us can end up on deep water during the life course, and most of us do on a perhaps not regular basis, but from time to time. But what is very important is the amount of time we spend on deep water. Because if something or someone doesn't come to our aid, then we are at increased risk markedly for tipping over the edge. And this is where we see the most common health problems, mental health problems, in terms of anxiety and depressive disorders. So like I said, to date, the focus scientifically and politically has been very much on treating the individual once you've gone over the edge, trying to drag the individual back up in the river, or trying to promote that you tip over the edge when you're already out on deep water. And I'd just like to underline that, of course, it's really important that we keep this focus. Of course, it is important that we ensure appropriate and timely treatment for those in need. And of course, we should do everything in our power to try and prevent people from going over the edge once they're already on deep water. But where this may be an appropriate strategy in reducing individual suffering, it is not an adequate strategy if we want to break or stop the amount of people from ending up down the deep end to begin with. As I hope the illustration shows, but if not, then look at our numbers. We've just seen an increase and increase and increase in mental health problems. And this is definitely not an appropriate or adequate strategy if our aim is that we want to increase the amount of people in the population who are flourishing or who have high levels of mental well-being. So, next to individual treatment and targeted prevention focusing on risk factors for mental illness, we need to focus on public mental health promotion. And here the main focus is on strengthening resources and protective factors for mental health and well-being. So these resources and protective factors are to be found at several different levels. And therefore we need to look at this from a whole systems approach. It's not enough to only target the individual. We have family and friends. We're social creatures by nature, so we get affected by one another and we are affected by the conditions we live under. So naturally our community and neighbourhoods, the legislation, environmental and social environments play an important role. In the ABCs of mental health, which I will now tell you a little bit about, we therefore naturally focus on several levels. When we fall ill, the responsibility to treat us lies very firmly embedded within the healthcare sector. But most of the drivers of mental health and well-being, they actually lie outside the healthcare sector in the arenas where we live, love, work and play. And this is why, with the generous financial support from the Nordea Foundation, we've started the ABCs of Mental Health Partnership. And the ABCs of Mental Health is inspired by and based on an Australian mental health promoting campaign, the Act, Belong, Commit campaign developed at Curtin University, and we've adapted it to Danish context. In the partnership, we are a multitude of partners. There are a lot of municipalities across Denmark, large organisations, NGOs and researchers, and we've joined forces to promote public mental health. Now the partners may have slightly different target groups or focus areas, but what joins this partnership together is that we're all pulling in the same direction. We're all working from a mutual understanding of what constitutes mental health and how we should be promoting it. So we work with a research-based framework, the ABC framework, and this has got 3 overall domains of focus. These are the domains or the areas where we want to empower people. The first one is do something active. The second area of focus is belonging, doing something with someone. And the third area is commitment and doing something meaningful. And I'll elaborate on these 3 domains in a minute. But this is what forms the basis for all our communication and campaign activities, for activities we do local partners and across the partnership. And it also forms the basis for our training and up-qualification of front personnel and volunteers. And like I said, it's important to have a whole systems approach. So we work at several levels. At the individual level, we work on promoting mental health literacy, raising awareness about what we know you can do to look after your own mental health and that of others. Do when we come out and tell people it's not good for them to smoke or it's a good idea to go for a run. At the group level, we work very much with increasing inclusive communities, with training and up-qualification of front personnel and volunteers, where we help support them to better be able to enable and empower the people they come in touch with. We also work across sectors and disciplines, and we do this because rather than sitting in each our own silo and reinventing the wheel, we want to use all the different types of resources and expertise that are out there in a new way. So we meet up in this partnership 4 times a year, and this has turned out to be very fruitful. Like one of the coordinators said, that with so many different personalities from many different organisations, NGOs and municipalities, we're forced to think outside the box. And this has resulted in creative ways of addressing and working with mental health, and many of the activities, talks, workshops we've developed have been thanks to the collaboration in the ABC partnership. Here at the National Institute of Public Health, the University of Southern Denmark, we've been the initiators of the partnership, and so we're also responsible for coordinating the partnership and leading it. But we're also responsible for creating the best possible knowledge base. So we do different types of research. We do qualitative research, quantitative research in forms of cross-sectional and longitudinal studies. We do process evaluation, and we've done action-based research, where the research we do keeps feeding into the way we work. And if you want to read any of these scientific articles, you can access them on our website, www.abc.dk. Some of the other partners have got other main areas of responsibility. So we've got the Danish Mental Health Foundation, they're in charge of our communication and campaign activities. We've got the Danish Gymnastics Association and the Danish Scouts, who have helped develop training targeted to volunteers all over the country. And we've got the Centre for Prevention in Practice, I would translate it as, under municipalities, and they're very much in charge of training municipal ABC coordinators and giving advice to municipalities about mental health promotion. If I highlight a little bit about the 3 focus areas that we're working from, the first one was do something active, and here it's important to say that we can try and treat people when they fall ill, or we can try and prevent them from falling ill, but we cannot pour mental health and well-being onto people without their active participation. But we can create the best circumstances for more people to be able to do something active for their mental health. And the other way of understanding this is we know from research that staying physically active is important for your mental health, staying mentally active, So doing something that requires concentration. It can be learning a new skill. It can be doing a crossword. We need to keep spiritually active. So this can be, if you're religious, you can go to church or the mosque. If you're not, it can be mindfulness, it can be meditation, it can be yoga, but it can also be talking about existential things in life with a friend. So something that is bigger and beyond you. And doing something active for your mental health actually also means taking time out to just be calm and restitute. It's important that we stay culturally active. We understand ourselves and the world around us through cultural activities in a better way. And this can be anything from reading the local newspaper, or going to the library, or seeing a play at the theatre, or going to a concert. But staying active is important for mental health. Having a sense of belonging and good social networks is probably the most fundamental thing for good mental health and well-being throughout life. So at an individual level, we want to remind people to keep in touch with family and friends, to perhaps join a club, to join in different community activities. And it may sound simple, but we know that when people get very, very busy, quite often what they do is they tend to stop socialising, because this is one of the things you can cut back on, but it's not actually, from a mental health perspective, a good idea to cut back here. We also want to encourage people to open up their social networks for others, because mental health is something we create together. But also we know that it may be harder for some to join in different activities, and not everyone is privileged enough to have a strong social network. So at a group level, first of all, we work with up-qualification of front personnel and volunteers in creating more inclusive communities, where we have a strong focus on not only a good welcome, but making people want to come and join in and stay. The other thing is that different period times in our life may affect our social networks. So if you are a refugee, for example, that has had to flee, this is obviously likely to affect the social networks you've had. If you are a young student moving to another city, this will affect it. If you become widowed, it will affect your social networks. So the people we work with, the front personnel and volunteers, what we ask them to consider is, in any given situation, how can we best enable and help and support these people to act, belong and commit? And naturally, it will be different what is needed for a young guy with social anxiety living in the countryside than perhaps what will be needed for an elderly woman with bad hips living on the 4th floor in town. But it is important that we always consider the circumstances for being able to do something active, do something with someone and do something meaningful. So this leads me to the final point here of doing something meaningful. And here it is important for me to say and stress, we don't go out to people and say this is meaningful to engage in and this isn't. The important thing isn't really what it is that feels meaningful to the individual, but rather that it feels meaningful. We all need a sense of meaning and purpose, something or someone to get out of bed for in the morning. And we know from research that we can strengthen this sense of meaning and purpose through, for example, setting yourself short or long-term goals, through engaging in an activity that gives you pleasure, through learning something new, but also actually from helping others. Helping others is a great way to self-help. And we know from our studies that volunteering is strongly associated with mental health, and it's not just that those with better mental health volunteer, it's also that, but it also goes the other way around, which makes complete sense. Because when you volunteer, you do something active, you may be learning a new skill, you widen your social network, and it gives you a sense of meaning and purpose and of contributing to something else above and above, beyond yourself. So do something active, do something with someone, do something meaningful. They are the ABCs of mental health. And I put a little folder on your chair. It's slightly outdated in terms of the partnership that just keeps growing. But this is just to say that sometimes we communicate the messages out more or less like I've just done. And we communicate this information out via all the partners' channels and also where they meet people in their activities. But just as often, we target and do alternative ways of communicating because, quite frankly, not everyone gets turned on by a leaflet telling you what to do, surprisingly enough. So we also run different types of campaigns. And we've run different ones, one called Join the Club, one was Your Old Hobby Misses You, Knocked Out by Day-to-Day Life. And this year, which I'm really interested and excited about, we're doing meetings across. So meetings across generations, cultures, social groups. And it's always good to have something to meet up around when you don't know one another. So music is a fairly non-dangerous thing to meet up about. And we've had Inaugural and Total Hip Replacement, which is a young funk reggae band from Aarhus, write a song for us on their take of the ABC messages. And it's called and it's available on all streaming services. I highly recommend you go and listen to it. It's a very good song. And we're going to use this to try and create socio-musical interventions. Basically we're experimenting to try and see how can we get people to act along and commit and meet up in different ways. So this will be very interesting, and it's something that we're running throughout the entire partnership. All the partners have a local coordinator. They're the ones that sit at our local network meetings. They have at least one coordinator, and they're trained in the ABC mindset. And their job is basically to make sure that what we know from research you can do to look after your own mental health and that of others actually reaches a broad variety of the population. The other thing is that it's important that they then let the people that live in their local areas know what resources and activities and things are going on here that might be interesting for you. And it's also important that they use this framework and this new common language to try and create synergy with some of the activities and resources that are already out there, so that we use our resources in a better way. So the municipalities are working together with civic society, but they're also working across from the health sector to the social sector to the cultural sector, etc. And if I should just sum up our findings to date, then we have found that this ABCs offers a very simple framework and a common language which enables cross-disciplinary mental health promotion. The focus of the ABC messages appear to resonate across disciplines, sectors and various population groups. And the generic nature of the ABCs just make them translatable to various contexts and various target groups. Finally, they're considered easy to understand, easy to act on, positive and destigmatizing, because acting, belonging and committing isn't something we should be doing merely because we might be old and lonely or because we might be experiencing mental health problems. Acting, belonging and committing is something we should all be doing. So far so good. In this next period of time, what we're going to dive more into is to find out more about what works best for whom, how, why, under what circumstances. Because our longitudinal studies suggest that there may be a huge potential in promoting mental health, preventing mental illness, and also promoting cognitive functioning by working with a focus on the ABCs. As it is probably abundantly clear by now, I do have a dream of us creating a society where we create the best conditions for all, regardless of their circumstances, to stay active, to do something with someone, and to do something meaningful in the arenas where we live, love, work and play. But I also have a very strong dream of establishing a cross-sectoral, cross-disciplinary research, knowledge, education, action, perhaps also advice centre for public and clinical mental health promotion. And luckily, we know what we should be doing, because ample of recommendations and reports are out there pointing to what we should be doing. Only to date there's been an awful lot of rhetoric and very little action within this field. But we know we should be bridging the gap between research, policy and practice. We should be strengthening cross-sectoral collaboration. We should be investing in better mental health and wellbeing research and data. Scale up mental health promotion and prevention efforts and help the implementation of good evidence-based programs. We need to promote a way more holistic view of mental health and foster the importance of well-being. Like I said, it isn't just nice to have, it is need to have. And we need to improve mental health literacy in the public and private sector as well as in the general population. Build capacity to empower end users, mobilise relevant stakeholders and increase political support, and incorporate mental health in all policies at all levels. So now it's just, cracking on and doing this. But I actually don't think that this is that far out of reach. We've already got very good experiences in doing a lot of these things in the partnership of the APCs and mental health. I do believe that if we need to systematically and efficiently bridge the gap between research, policy and practice and ensure that our policies are informed and mentally health promoting, then it requires someone to take the lead. We need someone who can create and inspire a shared vision and action for change. And those who lead this field need a comprehensive understanding of public mental health and well-being and mental health promotion. So this requires, obviously, that we stand on a firm knowledge or research base, and we also need to generate new knowledge in this area. We need better data and evidence. To date, there's so many questions that we're not even asking. So, for example, why have we seen this negative development in public mental health? No one really knows. How do we best promote what matters in people's lives? How do we scale up and best implement mental health promoting activities? What actually works best for whom, how, why, under what circumstances? We need to start moving our focus away from just focusing on mental illness, yes or no, to knowing a lot more about protective factors, resources, and mental well-being. And so that it doesn't just become research behind research desks where we write scientific articles for other researchers that can quote us when they write theirs. So we move from rhetoric to action. We obviously also need to be able to mobilise relevant stakeholders. We need to be able to connect the evidence with the policy, the people and the practice. And this we will do through promoting collaborative action, raising awareness, improving mental health literacy in the public and private sector. We will use this knowledge that we get to advance knowledge, build capacity and training. But in order to do all this, we need to secure long-term funding. Because way too many promising projects, they end up as soon as we run out of money and the project period ends. And this means very often we start up reinventing the wheel in a new different silo. We need to put on the long lights, we need to be more visionary, and we need to secure the long term. So if there are any funders out here today, please do feel free to contact me. I'd be more than happy to come for a coffee meeting and elaborate on the potential and the possibilities and perhaps the scope and the synergies we could create in this. If you want to be the pioneers, the front runners, then here's your opportunity. Okay, so a well-known epidemiologist within public health, Geoffrey Rose, he argued that if we could shift the entire distribution of the population, if we could move everyone further upriver, down the shallow end, then this could have vast implications and the public strategy is likely to be better than just targeting at-risk groups. So from this theory and this perspective, then I would argue that even a small improvement in overall population mental health can lead to a marked reduction in common mental health problems and a vast increase in the amount who are flourishing. So I would just like to thank you very much for your attention and leave you with the words of Elvis, that I hope in future we'll see a little less conversation but a lot more action in this area. Thank you very much.